right. Oh, so to see the slides, I have to turn around slightly. All right, that's perfectly fine. Okay. Well, good afternoon, everyone. Thank you for having me here today. I'm really honored to be here. To get started, I just wanted to reassure you, for those that don't know, Consumers Union is the policy and advocacy arm of Consumer Reports, the magazine that you know, love, and trust, and subscribe to. Not everyone realizes this, but we're a nonprofit, mission-driven organization. Our mission is to keep consumers safe in the marketplace, keep them informed. In order to carry out that mission, we also work in the regulatory and legislative arenas, and that's where I work on health policy issues. Not everyone realizes this. We don't accept any advertising. We don't accept any free samples. We purchase everything we test, which is why we have a pretty darn good reputation out there in the marketplace. I'm really excited to be here today because we're at a wonderful time in the health policy world, and I want to take just a little bit of a step back. I want you to put aside political rhetoric that may have bugged you over the last 5 years, and I want you to put aside software problems and other glitches that have occurred, and just take a moment, because this is a really unique time. I have to see where I am in the health policy world. We have reframed the debate around coverage. It is no longer the status quo that you can sell junk health insurance policies, that you can, that consumers' ability to get health insurance might depend on their health status or what kind of employer they work for. That is ancient history, and we are not going back. And that is significant. It's really significant. When you have reframed the debate, as wonderful as these new enrollment numbers are, as incredible as it is that we've had this measurable drop in the number of uninsured and people are getting the health care that they need, when you have reframed the debate and you now have a different starting point, that is real progress. So we should all be very proud, and it really is an exciting time. But what I'm here to talk to you about today is a whole nother debate going on, and we're kind of at the very beginnings of this debate. And pardon me for turning around, I just want to make sure I'm on the slide that I think I am. This debate is variously called provider payment reform, delivery system reform, health system transformation. We've already referred to it today. We call it working for better healthcare value. I direct an entity within Consumers Union called the Healthcare Value Hub, and this is a brand new center funded by the Robert Wood Johnson Foundation, and its mission is to help get us to better value. And we do that by working with advocates all around the country, by monitoring and translating the evidence for others with respect to all the interventions that might bring about better healthcare value, and by networking people together across stakeholder groups. So if we're going to talk about getting to better healthcare value, how do we know we have poor value now? Well, there's a whole host of reasons why we're overpaying for healthcare and not getting the value that we should get. One is the IOM, as you're probably all aware, has estimated that up to 30% of our healthcare is waste, and they've identified 6 categories of waste. And some of those are the administrative waste that goes on with administrative hassles that don't have to be there. They come out of the way we pay for healthcare now. Things like avoidable emergency room care that we're consuming that we shouldn't have had to consume in the first place, duplicative medical tests. We have, I'm sure folks in this room are aware, our health outcomes actually lag those of other developed countries. And medical errors, preventable medical errors that occur in hospitals. That is the 3rd leading cause of death. Not widely understood, but a major value problem that needs to be addressed. And finally, we overpay, and while Maryland is a little bit of an exception, and we're going to talk about this, there is widespread variation in the price for the same service in the same city. And that is not acceptable because healthcare isn't this luxury item that you have the option of consuming or not consuming. It's something that we need, and it has to be priced fairly. when we have poor value, this is a great consumer hardship. Healthcare is very, very expensive, and if you can't afford to buy coverage or you can't afford your out-of-pocket costs when it's time to consume services, the documentation is very good. You underconsume healthcare. You're not getting the healthcare that you should get for optimal use. It also results in lower paychecks because our employers are struggling to meet their healthcare obligations. There's actual physical harm to consumers when they experience a medical error. There can be disability or even death. And it's diverting public resources from other uses that we care about, roads and schools and things like that, if we overpay for healthcare. This is basically, I'm sure you'll all agree, unacceptable. We can't let this status quo continue. This is a pretty famous chart just showing that our wages are going like this and healthcare costs are going like this. And that's clearly unsustainable, even if you hate looking at graphs. So enough of that bad news. Now that I hopefully have you all filled with anxiety and worried, let's talk about all the good news that's out there. I mentioned there's another big debate going on. All around the country, there are multiple stakeholder groups working to transform how we deliver healthcare and begin to address those value problems that I just talked about. And as a national expert in healthcare policy, I'm here to reinforce what you've already heard today. Maryland is a leader in these efforts. I mean, it is really one of the top states in terms of what they're doing. You've already heard about some of these initiatives, and you're going to hear more this afternoon. But to get rid of the jargon for a moment, I'll just speak broadly to what are these initiatives trying to accomplish. Well, they're trying to do things like make the way we spend money on healthcare and the kind of quality being offered up by providers more transparent, not just to regular consumers, but to policymakers and regulators, and that's a very good thing. Healthcare is one of the most opaque marketplaces that we have in this country, and obviously you can't solve problems when you can't see them. In addition, it's trying to incent providers to deliver care differently so that we can start to emulate the best providers out there. You heard me sort of trash-talking providers, but there are some best practice providers who are doing a great job, and everybody agrees. We got to make all the providers practice like those best practice providers. The CRISP system is a way of sharing information so that when you're treating a patient, you're not missing whole swaths of information about that patient's history and what was going on with them. And finally, they're engaging consumers. And that is the theme of today's conference, and that's where I'm going to spend the most time with my talk today. But for me, what all of this activity adds up to in Maryland is a public commitment to not only working towards better healthcare value, more transparency in the system, but to bringing consumers along every step of the way. And again, they're a national leader in that regard. There are states for whom the consumer could never figure out what kind of quality is offered in a hospital. You know, what's their rate of hospital-acquired conditions, things that you've heard mentioned today. So you should all be really, really proud of the work going on here in Maryland. So given that the theme is consumer engagement, and given that Maryland is a leader, but we can always do better, let's really drill down on what does this mean. I'm going to start by telling you what is not consumer engagement. I don't think you'll quibble with this too much. First of all, the rather awful expression, giving consumers skin in the game, which refers to having them pay more cost sharing in an effort to get them to focus their choices, that is a bunch of hogwash. There's plenty of evidence to show this is it's a blunt instrument, it's extremely ineffective, because you're saying, consumers, you have to pay more out of pocket, but we're not going to give you a single usable tool to help you make a good decision. And even here in Maryland, the tool set is still not good enough, and we'll talk a little bit about why. It's, so you got to keep both ideas in mind. We're a leader, but there's still a place to go for us. That, don't even think for a minute that this counts as consumer engagement, because it does not. Here's another one that you might quibble with. An attitude that says, oh, we want consumers to know this, so we're just going to educate them, and then all will be good. As you're going to hear me talk about, that is not good enough. Consumers have busy lives, and you have to make a business case for why they should listen to your information. And that is really our mission. We can't just educate them about what we think we want them to know. That's not how it works. the resources you spend on educating them may not be effective because you might not have done it right, or you might not be delivering the information in the way they want to see it, as we're going to talk about. Well, enough negativity. What is consumer engagement? I think of consumer engagement as a continuum that has many parts to it. First of all, there's your everyday consumer, if you will. We're very interested in reaching that person, and they're actually interested in hearing from you. And I'm going to spend most of my remaining time talking about that entity, so I'll stop there. But there's also that foundational research that takes place to understand where consumers are coming from. That's vitally important, and it is a form of consumer engagement because it can inform your outreach efforts. Then we have the heroes, many of whom are in this room, who often on a volunteer basis are serving on advisory boards, governance boards, work groups, task forces. This is hard work. It often requires a lot of technical sophistication. You're often outgunned by other stakeholder groups. And one of the best things we can do is help support those people. Families USA has just brought out an excellent piece. I don't know if any came here today. Okay. Okay, well, you should all rush over to Lydia after my talk and try to get one of these. They did a survey of 6 states looking at how states that have SIM grants, State Innovation Model Grants from the federal government, are engaging consumers. And they looked at a huge number of benchmarks, and it's going to be very useful for how we think about consumer engagement with respect to these activist type of people, again, who are true heroes and need our support in order to be more effective. And lastly, there's working with professional consumer advocates such as myself. I get paid to be a consumer advocate. It's pretty much the best job in the world. And it's, we're here as a resource to help others, and you should call upon us whenever you need our help. So here's the promise drill down. I'm going to spend the rest of my time talking about regular consumers because I want to be sure that we do it right. I want to be sure we do the right things and we don't do the wrong things. So here's my recipe for successfully engaging those people. First of all, you have to do your foundational research to understand where they're coming from. And if there's anyone from Healthcare for All here today, I'll do a shout out to Vinnie DeMarco's group, who did that focus group work to understand where are people coming from if I wanted to talk with them about the Medicare waiver on hospital all-payer rate setting. That's exactly what we should be doing. It almost never happens. So that is always your first step. You don't start drafting your communications piece right away. Next step, is there a business case for your information? Is there something for the consumer to do? Is it actionable? Should they care about your information? Consumers have busy lives, and you know it. You're busy yourself, and you know how much information you reject that people are trying to send to you. So we really have to be strategic about the information we choose to put in front of them and make sure it's the information where there is something for them to do and there's a business case. It's going to help this consumer. It's not just to make you feel good. It's going to actually help them. The context for your information is vitally important. Ideally, your information, if you're trying to engage consumers, is going to be delivered just in time. Lenny stole my whole presentation. I hope you saw that. If you put information up on a website and the consumer doesn't know it's there, you have not yet helped them. We've got to figure out how to get information to consumers right at the point where they need it. So think about, for example, health plan shopping. You have to go through that exercise. You're sitting in front of the navigator. What is the other little bit of information we might want to put in front of them because it's just in time and it's going to help them make a better health plan decision and maybe lead to better health care value in this state? That type of thing. What is the source for your information? If I have learned nothing else across my years of focus group work, it's that the information can be perfect in every other dimension. It can be written in plain language. It can have white space. It can have graphics. It can be accurate. It can be important. And if it comes from somebody that they have never heard of and is not a trusted source, the consumer will not act on that information. So you have to think, you have to use your trusted sources for information or cultivate your own entity as a trusted source for information so that they'll act on what you want to tell them. It's very, very important. And finally, you should always consumer test this information. It's amazing how often regulatory bodies put some sort of a consumer disclosure out there and they've never tested it. people have a bias. They think, well, I'm a consumer, so I must know how they'll react to the information, but you don't because you probably know more about the subject than they do. So consumer testing is very important. It can be fairly low cost and informal, and you'll learn stuff right away if you even test with 5 people. So why is it important to know consumers' attitudes? Coming back to that foundational research I talked about, consumers don't know what to do with information that is outside of their existing framework. And I'm going to give you an example. If you introduce information that's within their framework or is maybe very close to what they know, they are going to absorb it and know what to do with it. But if you give them information that's far outside their existing framework, they may ignore it because they can't fit it into what they understand. And here's a specific example for you. I'm about to talk about some research that we did where we were trying to understand consumers' attitudes and awareness of things like healthcare cost, healthcare quality, and an overall, healthcare value. How can we start? We wanted to know the question being asked today: how do we engage you in the conversation about healthcare value? And we tested a lot of information with consumers. A piece of information that did not resonate at all is the information about how we compare internationally. The fact that we pay twice as much in this country and our quality is less. People didn't believe it. It was that star completely outside their framework. So you're not going to get any traction with that information. So once you understand that, you don't use that information. You use something else. If it's important for you to introduce new information that is currently outside their framework, there is a way to do it. And I'm going to give you an example. People believe that healthcare quality in this country is uniform and high. And unfortunately, that is actually not the case. And what we did when we were talking about medical errors in this country is we anchored it to other information that they knew. And I'm going to show you an example of that. So there is a technique for introducing new information. This is the study that I'm referring to. It was a mixed methods project that involved a lit review, and the lit review said, well, there's been lots of neat work here and it doesn't add up to a coherent whole. So we tried to plug some of those research gaps with our focus group work, and then we were very curious if what we learned in the focus groups would play out nationally, and we did a nationally representative survey. This is all in the public domain. I'm afraid that some of these are rather lengthy reports, but still, if it's of use to you in your work, please go and read them. So what did we learn? Well, this is pretty interesting. It won't surprise you to learn that consumers care deeply about healthcare costs. Again, this is something that's vital to their financial and physical well-being. And they are very outraged. It doesn't take much to tap into their outrage about high healthcare costs. But, and they feel, because this feels very unjust to them, they think of healthcare as more of a social good that people should have access to. It's a basic right. They think that someone, preferably a government entity, should be working on this problem. And this is significant for 2 reasons. One, this desire for a powerful entity to help combat the problem was universal across the political spectrum. We have all the video from all these focus groups, if you don't believe me, and wonderful clips of people saying, I'm a Republican, and I hate to say this, but I think it's going to have to be a government entity that deals with this problem. And this is rational. They realize that the stakeholders involved, who may have a bit too much market power, or the various reasons that we have our problems that we have, are extremely powerful, and it's going to take a countervailing power to bring everything into balance. The other reason this is important is policymakers, regulators, legislators have permission from consumers to work on this issue. This is well within your portfolio. And for some areas of the country, this is brand new news, not Maryland so much. But it's extremely important to know that this is considered by consumers of every stripe all around the country to be important for their regulators and policymakers to be working on. Interesting, this was a little bit of a surprising finding for us. Consumers support a very broad range of initiatives. Now, I will be the first to admit they're not in a position to understand what these mean in depth. They can only understand them at a high level. But the fact is, everything's on the table for consumers, with one interesting exception. When it comes to changing how we pay providers, they totally support penalizing providers for poor performance. But, and this is confirmed by a study beyond ours, they actually do not support rewarding providers for good performance. They believe that starting framework that they have, that's providers' job. It's your job to give me top-notch medical care, and why should you be paid more for doing what is your job? So for what it's worth, that is the one intervention of the ones that we explored with them that had a little bit less support. And again, this is supported by a second study. So what motivates consumers to act? A lot of people who are seeking to engage consumers, they want that consumer to do something. So how do we get them to do something? Well, first of all, you have to deliver your information in the right way. It has to be anchored to information they know, as we already talked about. When you can include local information as opposed to kind of generic information, local specific information is much more motivating when it comes to trying to get them to act. And I'll give you an example of that. It needs to be from a trusted source. We already talked about that. And then finally, it has to evoke an emotional response. And that may sound like you're cheating a little bit, but it's just the way this thing works. I'll give you an example of that as well. And you have to give them something to do. As we explored these healthcare system problems and possible solutions with consumers, they were so frustrated in these focus groups that we actually didn't have anything for them to do. They were fired up. They were ready to do something for us. So what are they willing to do? Well, they want to be told what to do. They don't want to have to figure it out for themselves. Totally spell it out for them. Again, they have busy lives. They are willing to take personal actions. That was the first thing that they thought of. Well, we should all probably eat a little better and get a little bit more exercise, all those things. That's the first thing they think of. But they quickly realize that that's probably going to be insufficient because, again, these are big system-wide problems that have some very powerful stakeholders going on behind them. So they would also willing to take system-directed actions. In other words, prodding their legislature or their regulator or writing a letter or whatever it might be. But they realized that their voice alone was likely to be completely ineffective. So here's what they really want. They want some third-party entity to organize them together so that they're part of a movement that has lots of people involved that is actually going to have an impact. Okay, again, pretty rational when you think about it. So that's their desire. That's their heart's desire. So here's an example of some information that we provided to them, and it has a couple attributes. One, so what this information is, it's looking at the hospital markup going on in 4 hospitals in St. Louis, and we name what those hospitals are. I can't show you this information from Maryland because it's pretty boring. The hospitals are paid all the same amount. Roughly the same amount. So this is very motivating information because it is local information. The people, when we tested in St. Louis, they know these hospitals and they know things about what kind of patients go there and somebody had a surgery there and all sorts of stuff. And they layer that information on and they're engaged. You've captured them. The large markup that we all know is out there, but to put it in black and white evoked that emotional response that we're looking for. Now, when we did this for low-cost things like a bottle of saline or a bottle of Tylenol, we know the markups are just as high. Everyone in this room knows that. They couldn't have cared less because there's only a few dollars involved. That was not effective. It didn't get the emotional response. It needed to be a big-ticket item like this. And this was very interesting. We spent a lot of time talking about hospitals, and I think consumers bring a great attitude into this equation. They realize that hospitals are a business, and they are not opposed to hospitals making some profit. There's room to work there. What they're opposed to is excess profit, because again, this is a good or a service that everybody has to have when they have to have it, and they don't want excess profit being taken. So for what it's worth, that's what they told us. Here's the example of how we started talking with them about hospital-acquired infections. People do not believe that we have high rates of hospital-acquired infections in this country. But they're very familiar with the information about drunk driving deaths. They feel that drunk driving deaths are very common. There's a story in the paper every couple weeks about a drunk driving death. It's a big problem. They're also familiar with the advocacy efforts of MAD to try to address that problem. When you put those two things side by side, suddenly the information on hospital-acquired infections is accessible to them because we've anchored it to something they know. We've said, look, this is an even bigger problem. And they've kind of got the advocacy success of the MAD organization in their mind, and they're thinking, maybe we could band together and do something about hospital-acquired infections. So that's an example of introducing information that was outside their framework, but linking it to something they know, as I talked about in the beginning. So I'm wrapping up here, and I really want to leave you with this important point. Consumer engagement, consumer participation is vitally important, but it is not a panacea that's going to cure all our health system problems. Consumers direct less than 10% of our healthcare spending, less than 10%. If you're trying to identify what comes out of their pocket and is also shoppable, in other words, they have the conceivable option of choosing from among two alternatives. It's not an emergency. And if you were to layer on the requirement that they had usable information to help them shop, usable information on what it would cost them, usable information on quality or the effectiveness of the treatment, suddenly that 10% goes almost to zero because we don't have very good information like that. So while it is just and fair and correct to engage consumers and to ask them to be better shoppers, if that's the way you're trying to engage them, that can't be the only intervention that we're talking about as a community that wants to solve our healthcare value problems. It will be insufficient based on that data I just put up there. So, to wrap this up, it's a new day in both of our policy realms. We talked about the policy debate over coverage. It's a completely different debate. And we're just starting that over here in the health system transformation, the getting to better healthcare value conversation. And you're all part of it at the beginning. So I look forward to working with you as we travel down that path and hopefully realize a lot of success with Maryland probably, being out there in front and as a leader for a long time, other states looking to see what you're doing here. So thank you very much.